Welcome to the Department of Ophthalmology at California Pacific Medical Center. This is a virtual tour of the residency training program, our facilities, community, and culture. CPMC Ophthalmology has a long history of training residents to become excellent clinicians and surgeons. Today, our residents rotate throughout the greater San Francisco Bay Area in order to serve the diverse population that lives here. We opened a new state-of-the-art facility in San Francisco in 2018. The Pacific Vision Eye Institute is our home base. It consolidates several vital features of the residency program into one central location, including an education center for resident education, the Lion's Eye Resident Clinic, the Ophthalmic Diagnostic Services Office, an ambulatory surgery center, and many of the practices of our teaching faculty. Residents rotate through several sites to complete their training. They spend the majority of their time at the Lion's Eye Clinic in San Francisco. This is a resident-run clinic where we care for some of the most vulnerable patients in our community. To broaden their experience, our residents rotate at Kaiser Hospital in San Francisco, where they learn advanced cataract techniques, as well as Highland Hospital in Oakland, which is a county hospital and a level 1 trauma center. During subspecialty rotations, residents rotate with nationally respected ophthalmologists who practice throughout the San Francisco Bay Area in a variety of practice settings. The heart of our program is made up of our faculty, a close-knit group of ophthalmologists who are deeply committed to resident education. We all share in the commitment to caring for the underserved population of Northern California, and that commitment is something that we look for in our applicants. We are initiating 2 significant changes to CPMC's historic ophthalmology training program this year. In the past, our residency curriculum has been staggered, meaning each resident has started 4 months after the last. Starting in July of 2021, all admitted residents will begin residency together. We are also initiating a joint internship with the Department of Internal Medicine that will begin in July of 2021. We hope you find this video informative.
The history of this department is quite interesting. We are the oldest ophthalmology department in the West by many, many years. We began in 1872 and have had an unblemished and unbroken record since that time. We've seen many situations, survived good times and bad times, and we are flourishing now with our new space, our new ASC, and the future looks as good as the past has been.
My primary goal was that I wanted to find the program that was going to train me the best, specifically how to be the best surgeon and the best clinician.
Having been in this program for a little over 6 months, I feel like I've developed the skills necessary to not only evaluate a patient very efficiently, but also have a very solid understanding of the type of pathology I'm dealing with.
The uniqueness of our program is based on our faculty, because our faculty really treat the residents as if they are colleagues. And we know that in a very short period of time, they will be.
The biggest advantage, I think, is the fact that they have a lot of people that they learn from. If you're in university, there may be 15, 20 faculty members, whereas here there's probably 40, 50 of us between all of our private practices and the academic teachings.
The type of relationship is very collegial, and that really bodes well for the residents because they feel really comfortable asking any of the attending physicians any questions, anything related to ophthalmology. And they really take you under the wing.
They come to our office, so they see patients with us. We also operate with the residents, and we have grand rounds and lectures, so they learn different aspects and different ways of learning.
The residents spend 2 months working with me on their oculoplastic rotation during their first year. As such, they literally are working almost as if they were my fellow, spending every day in the clinic and in the operating room with me learning oculoplastic surgery.
They're able to do refractive surgery. They have projects with refractive surgeons, so they learn a lot of new technology, which is more than just bread and butter, learning cataracts and regular retinal and other ocular diseases.
So some of the defining qualities of CPMC I would say is the surgical experience. truly you are the primary surgeon when you're doing any type of surgical case here. And that is a very unique experience that I would say not many programs in the country have that type of opportunity.
And I've seen the first-year residents come through my ORs as the first within the first month, and by the time they come into the second year, they're already proficient with the whole system. They're able to manage everything. They're able to set up any kind of follow-up for patients, any kind of surgery, any other consultation.
I'm also very interested in research and encourage the residents to do research projects with me, and have mentored several of the residents on award-winning Barcan projects.
I'm an alum from our program, which means that I spent a third of my residency here at Highland. Highland is a place where young doctors enter as residents but leave as ophthalmologists. It's here that we first hang a shingle over a door with your name, where you have your own patient panel and develop strong relationships with patients from all walks of life. Here, you'll see incredibly diverse pathology and be supported by a stellar group of attendings that are all dedicated to your education. For generations, this is where CPMC residents have mastered cataract surgery and have also been primary surgeons on a wide variety of complex surgeries, including incisional glaucoma surgery, MIGS, corneal transplants, IOL exchanges, to name a few. Residents on my service operate once to twice a week, and you do it all while having a good time. You're gonna work hard, it's hard work, but you will grow here, and you'll find a sense of purpose that's hard to find elsewhere.
Our residents are very successful in being able to pursue the things that they want to do after they finish training. That could be getting a university position, working in private practice, increasing their education, continuing their education by a fellowship program, and even beyond that, we've graduated several presidents of the American Academy of Ophthalmology, including the first female president of the American Academy of Ophthalmology and the second female president of the American Academy of Ophthalmology. Both of those women came from this program.
When you talk to a lot of attendings who worked with our residents after they graduate, they say specifically that we make really great clinicians because we know how to manage such a wide range of pathologies because we've seen it all.
So it's really unique to have a program where all the residents are in it to help one another.
We have a great group of residents.
At CPMC, we value the right person over the right resume, although they go together frequently. Despite COVID limitations, we still want to know you better and discover the people who will thrive during their time with us. As we hope to convey in this video, we're a unique training program seeking curious, empathetic, and motivated residents who get along and succeed together. The San Francisco Bay Area is a lively place that encourages fresh ideas and rewards innovation. Like the region, we're proud of our history, but we're even more excited about our future. I congratulate all of you for choosing the wonderful career of ophthalmology that excites us daily. I look forward to welcoming 3 of you into our CPMC family.